Histamine receptors blocker. So in this video we're going to talk about the histamine 2 receptor blocker. We already talked about the histamine 1. Now it's time for the histamine 2. So where are these histamine 2 receptors are located? Let's talk about them first, and then we'll be able to understand the mechanism of action of this class pretty easily. So as we know, histamine 1 is inflammatory mediator receptors. So it produces the inflammation signs and symptoms, while these histamine 2 receptors are located in the stomach. And what their function is, when histamine comes and binds to this receptor, it produces the acid in our stomach. So as we know, this is the mechanism, like when a histamine comes and binds to the histamine 2 receptors in stomach, it increases the secretions of acid in the stomach. That's pretty much the work of the histamine when it binds to the histamine 2 receptor. Now, when we give this medication, histamine 2 receptor blocker, it blocks the effect of histamine on histamine 2 receptor, so it doesn't let histamine it doesn't let histamine to bind to histamine 2 receptor, and it won't be able to produce any more acid in the stomach. So that's the mechanism of action of the histamine 2 receptor blocker medication. That it decreases so basically it decreases the secretion of acid in the stomach and intestine. Because there's some receptors also in intestine, and it prevents producing the acid in intestine intestine also. So what are the uses for this histamine 2 receptor? As we know, it prevents the production of acid, so it can be used in stomach ulcers, peptic ulcer disease. It could be used in intestinal ulcer, and also it's widely used as a prophylactic to prevent ulcer in acid or prevent ulcer or acid reflux in hospital. Like when you have a patient in ICU, their body is under so much stress. They're getting so many medication. They have a tube down to their throat. All the beeping, all the stress of ICU naturally produces more acid into their stomach. And when it produces more acid into their stomach, and they're laying in the bed all the time, there's a high chance they will have acid reflux, and then they can aspirate really badly. So in order to prevent that acid reflux and aspiration of acids into their lungs, they usually put them on this prophylactic histamine 2 receptor blockers in ICU. So that's one of the main use and widely used for that purpose as well. So what are the side effects? So this medication causes many GI problems as well, because it works on stomach and intestine. So it's definitely going to cause side effects on intestine. It can cause either diarrhea or constipation. Either way it can go. It can cause the bad headache, fatigue, nausea. It can cause the dry mouth, confusion. So this particular side effects is caused by only one drug, cimetidine. So this is a drug in this class, and the reason this medication causes the confusion, that is able to cross blood-brain barrier. The rest of the medication in this class is not able to cross this blood-brain barrier, except the cimetidine. So if a patient is on the cimetidine, it can cause the confusion. The easier way to remember is, like, the first letter in this one is C, and it causes the CNS side effects. So cimetidine causes CNS side effects, which is confusion. And these drugs also can decrease the all blood cells types, like red blood cells, white blood cells, and platelets. So that's why they sometimes need a frequent lab drawn in order to make sure they don't get any of the blood cells significantly lower that can cause the more problems. And it can cause the gynecomastia as well. What are the examples of these medications? Ranitidine, cimetidine, famotidine, and nizatidine. It's really easy to recognize these drugs as tidine, 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 and tidine. So any drugs that ends with the tidine as histamine 2 receptor blockers. That was pretty short classes. If you have any questions, any concerns about this video, just let us know.